Hi, so this video tells us about the sanitization, disinfection and sterilization procedure. So before beginning with the sanitization, I have done my hand hygiene and donned the personal protective equipment along with the heavy duty gloves. So now we begin with the sanitization procedure. So we have our three articles here, which is the needle holder, the scissors and the artery forceps. So in the sanitization procedure, first, since we have these contaminated articles, so first we will begin with the rinse of the cold water. So we will thoroughly rinse our articles with the cold water first and then place them in the disinfectant. So here we have our disinfectant tray and we are going to place it in the disinfectant for some time. So after our instruments have been disinfected for some time, now we are going to start with the scrubbing. So here we have our scrub and we are going to rinse our instruments with scrub and detergent and water for 20 minutes. So after we have scrubbed our instruments, now we are going to rinse them in hot water. So after we have thoroughly sanitized our instruments, we are going to then place them on a dry towel. And let them dry thoroughly. So the rationale of the sanitization procedure is basically to remove all the debris or the contents that can get attached once the instruments are in the surgery. So all the visible matter that is attached to the instruments is basically removed through scrubbing and rinsing them in water and thoroughly. So that is basically the rationale of the sanitization procedure. So once we have sanitized our instruments and have dried them, next procedure is going to be disinfection. So now we begin with disinfection. The disinfection generally takes place in the dirty area of the clinic. So we have here our dirty area of the clinic. So the purpose of the disinfection is primarily done for the instruments that cannot be sterilized, or where the spores or where the heat or moist related sterilization that is done through the autoclave that cannot be done in those instruments are basically disinfected. So for our disinfection, we have chosen the three instruments. So first is the stethoscope, then is our thermometer, and then we have our endoscope here. So for our stethoscope, the level of disinfection that is done is the low level of disinfection, and the disinfectant that is generally used is the 70% alcohol wipes. So here we have our alcohol wipe, and so first we will start with the disinfection of the diaphragm of the stethoscope. So just scrubbing and simply wiping off the diaphragm of the stethoscope, we will disinfect our stethoscope diaphragm. And next we have the tubing of the stethoscope. So gently rub over the tubings of the stethoscope with the alcohol wipe. And then we have the earpieces. That is also, we are going to scrub them with the alcohol dipped wipe. And this is how we disinfect our stethoscope. Next we move on to is our thermometer. So for the thermometer, the level of disinfection that is done is the intermediate level of disinfection, and it is also can be done with the 75% isopropyl alcohol. However, the point of difference is the extended period of time. So first we will prepare the 70% of ethyl alcohol, and then we're going to keep the thermometer into the solution for extended period of time, and this is how we disinfect our thermometer. So for the high level of disinfection, this is our instrument that is going to be disinfected, and this is our endoscope. So the disinfectant that we are going to use here is 0.5% of Cyrex, that is glutaraldehyde solution. So first we will prepare our solution, that is primarily done through, let's assume that this is a closed basket with a rim, and so first we are going to introduce our glutaraldehyde or disinfectant into the basket. So we should add enough amount of disinfectant so that it is able to submerge our endoscope, our instrument. So let's assume that our glutaraldehyde is in this basket, in this tub, and we are going to place our endoscope into the tub, and we are going to cover it with a lid. So once we have covered it with our lid, it is going to stay there for a certain period of time. Generally, it extends to the marking that is demonstrated by the manufacturer. So it can range into different time periods. So once we have placed our instrument into the tub, we are going to label the instrument with the disinfectant that we are using, the date and the time, and then our initials as well. So our procedure, the disinfectant procedure, the time period has now elapsed, and now we are going to remove the lid, and we are going to take out our endoscope, and we are going to drop, if there is any excess amount of disinfectant that is present, we are going to just rinse it off, and then we are going to take some sterile water, and then we are going to rinse it off with some sterile water, and this is how we are going to later on place it over a dry towel into a sterile area, and this is how we are going to complete the disinfection. So assuming this is our dirty area of the clinic, so we need to disinfect the dirty area of the clinic once we have used our once we have disinfected our instruments. So the chemical that is being used here is the household bleach. Generally, the bleach comes into concentration of 1:10. So assuming that this is our bleach, so once we have added the bleach, now we are going to just scrub off and wipe all the areas that were present here, and we are now going to disinfect. And this is how we disinfect the sink area, and even if there is any exam table that is present, we are going to just simply scrub that area, and this is how we disinfect the dirty area of our clinic. So now we begin with our sterilization procedure, and the important step here is to begin with the sterilization procedure. We are going to first start with the hand hygiene and washed hands. So now I have washed my hands and they are sterile now, and we begin with the wrapping of our instruments. The two instruments that we have taken here is the scissors that we have here and a reusable metal handle. So for the scissors, since the scissors needs to be kept in an open form so that the effective sterilization of the blades and the other ends of the scissors as well. So here we are going to introduce, just keep a piece of gauze between the two handles of the scissors so that it remains in an open form, and then we're going to cover the blades with a piece of gauze as well so that it prevents any uninjured kind of injury it can take place, or any staff can get stuck while they are doing the procedure. So once we have done that, we are going to place this sterilization strip. So this is going to indicate whether the effective sterilization has taken place or not. So after we have done that, we're going to start the beginning of the wrapping of our instrument. So since we have our sheet here that we're going to use the instruments to wrap, and we're going to take the one end of our sheet and we're going to fold it in such manner by pulling the end back, and similarly we're going to fold it on the other end as well with pulling the extreme end of the sheet back and folding it in such a manner. The rationale of this is it prevents, so once we are done with the sterilization, so it will prevent any recontamination that will occur. So once we are opening the wrap of the instruments, and this is how we are going to completely wrap our instruments. So after we have wrapped we have done the first wrapping of our instruments. So we are going to take another sheet and we are going to double wrap it. The rationale behind this is that it provides excellent microbial protection, and in case there is a breach that takes place during the autoclaving process. So the second layer, it provides the recontamination if it can occur. So similarly, we are going to do
it prevents recontamination.
It prevents recontamination. Similarly, we are going to do the second wrap as we had done previously for the first wrap. That is, we are going to take all the ends, folding them in a such manner so that we have two folds here. And similarly, we are going to place it. And so this is how we are going to complete our double wrapping. So once we have done our double wrapping, we are going to place the autoclave tape. So this tape has indicators. So once the autoclaving process has done successfully, there are going to be these dark marks that are going to display over once the autoclaving process has taken place. So we're going to go ahead and just put the tape over, and we're going to seal this packet.
That's enough.
So this is how we are going to seal our packet. We are also, so once we have sealed our packet for the sterilization, so with the instruments, we are going to put a label over this packet. It's going to contain the contents of this pack, the date and the time, and my initials. So we have here scissors and BP blade handle. It's gonna be Jan the 25th, 2024. The time is
6:20
p.m.
p.m.
6:20 p.m. and then we are going to have my initials here. So this is how we are going to complete our wrapping process, and now we are ready to put that into our autoclave. So now we have wrapped our instruments and we are going to place it in our autoclave. So here we have our autoclave, and we are going to check, we have checked the water levels in our autoclave and the wirings that is present. So our autoclave is now ready to work. So we are going to autoclave for 132 degrees Celsius for 4 minutes, and our autoclave has 3 trays now, and we are going to place in the bottom tray our wrap. And I'm going to select 4 minutes, and this is how we are going to go for our sterilization.
Can you repeat the temperatures, please?
So the temperature, there are 2 types of temperatures. One is the 121 degrees Celsius for 15 minutes, and another method is the fast method, that is 132 degrees Celsius for 4 minutes. So we are going with the fastest method for 4 minutes of sterilization.
Can you please tell us the rationale behind it as well?
Yeah, sure. So the rationale behind the sterilization procedure is that it helps to kill all the spore form of the microbes. So the other forms of the disinfection, of the chemical disinfection or sanitization, it does not kill the spore form of the microbes. However, sterilization is the only method which includes the heat and the moisture to together kill, destroy the spore forms, and this is how we are going to achieve total asepsis, that is the medical asepsis.
Thank you.